We started the Digital Health Accelerator to help early-stage startups get the resources they need to grow. We give each company $50,000 without ever taking equity. We also give each venture mentoring, marketing advice, business planning, and introductions to connect them with the right people at the right time with the right advice.
Because minority companies don't often have a seat at the table in the technology space, there's many great ideas that don't get heard, and we want to work to change that.
I think the DHA has been a huge part of our success because they've opened doors that we couldn't have otherwise been able to open. They've been able to provide informal market intelligence, clear guidance, supportive network, and mentorship that have weighed heavily in our success. And so, frankly, I don't believe that any other accelerator in the region would have provided us with the ecosystem, the support, the resources, and the people that we had access to at the DHA.
So when we applied to the DHA, we were down to $6 in our bank account. And there are two things that are gold to a startup: equity and cash flow. And the DHA allowed us to preserve our equity and gave us enough cash flow to survive for an additional year, not to mention free office space. So this was critical to allow us to get to where we are today.
You know, it's really hard to bring a medical device to the market as a small startup company. And DHA provided the non-dilutive funding and the free hand and just the right proportion of mentoring and advice that kind of made it all come together.
We're very excited to see how these young companies will transform the digital health landscape locally, nationally, and globally.